So first of all, we discuss this liver disease. First, we understand its liver anatomy and physiology is very important. This is a picture show us is liver. Liver in solid is a large solid organ in body. It's very large. Here show us is right lobe liver and left lobe, the esophagus. Another is behind the liver is gallbladder. Usually is liver circulation bile into the gallbladder, then from cyst duct, the common duct into the duodenum. Behind the liver is the stomach, duodenum, and small intestine. Here is pancreas. So I think here is a liver and actually think is an organ. I think the student is a very detailed understanding, no problem. So. The liver is a very classical way to divide the liver into 8 segments. We here show us is segment 1, 2, 3. It's a 4A, 4B, and 5, 6, 7, 8. Why divided 8 segments? I think the benefit we usually operation. For example, if a tumor located here, we do a segmentectomy. It means 2 segmentectomy. Or tumor located here, we usually is a left segment lobectomy. Yeah, so very useful, I think. So if you do a liver resection, liver operation, it's like 8 segment is understood. It's very important. It's except is divided segment. Another I think is here is means left lateral lobe. Here is right posterior lobe, right anterior lobe. Is left is anterior lobe. So. Here is a segmentectomy, lobectomy, and right hepatectomy, left hepatectomy. Okay.
Excuse me, Professor. What is the basis of segmentization? Like, why we divide it into 8? On which basis we divide it to 8 segments? On which basis?
Yeah, depends on glycine system. Yeah, do you know? Usually from here. It's a right, left, here maybe hepatic artery and portway from here. So you divide in the 8 segments, we depend is a glycine system. Do you know? So we usually from here open. Here is the concentration is later. So it's reduce bleeding during operation. So very important, I think.
So if the mass is between like 5th or 8th segment in between, so we will remove all this part of liver, right?
Yes. Yeah, so next I told you. This is back side of liver segment and lobe. Okay, the tone. Yeah. Here, just I say segment is anatomy. Here show us this is inflow is first is the first is hepatic halo. Here including is propel hepatic artery and portway and biliary. Common by doctor here. Usually, liver is a double blood flow. Do you know double? It's a hepatic artery and portway. Then is the blood is outflow here. Is a right hepatic way, middle hepatic way, and left hepatic way. So here is the second hepatic high. It's an outflow. Here inflow. It's a double blood flow. So the organ is a liver organ is different than another organ. It's very important. Yeah. Here show us is Gleason's fibrous show. We can see the first hepatic halo. Here. The first hepatic halo, including hepatic artery portal vein and common bile duct. Here is the second hepatic halo. So, and the third hepatic halo. So, is a liver is a 3 hepatic halo. Yeah. So we must detail understand this first, second, third hepatic halo. Very important. So if we do a liver resection, we usually is anatomy, the first, second, or third hepatic halo. Yeah. Here show us is third hepatic halo. Here show us about 4 to 50 is hepatic way, and port is blood into the inferior venous cavity. Yeah, here look is a short hepatic way like here. See, here picture show us left and right hepatic open. So third hepatic halo located here. The first hepatic halo here. The second here. So it's very important. This is picture show us is a biliary tract. It's a hold from intrahepatic duct, the left and the right, into here. It's a common hepatic duct. Then the gallbladder is a cyst duct. It's a cyst duct join is a common hepatic duct into form is a common bile duct. So it's a bile from here into the duodenum. This is a very important picture. In addition to the gross anatomy of the liver, we can also have a histology view of the liver. We can see the mass of hepatocyte arranged along the center is the way the liver loop as well as sinusoid in the microscope. This is gross, is anatomy. Here is micro, is anatomy. This is a portal chart. It's a portway arterial blood into the here, portal chart. Then into here is a center hepatic way, is blood into is a right hepatic way, middle and left hepatic into the inferior canal venom, IVC is. Now, red tongue is liver physiology now. Do you know is liver is a lot of the function is liver is carried out by the liver cell. Here show us the liver is synthesis is a function, the first. Then break it down is a function, another function is different. So here show us is liver is a larger number of material which in dance either with functions metabolism and bile circulation and coagulation, immunology and so on. So I think it liver just like chemical factory of body. So very important. Now we discussions liver abscess. Is usually liver abscess means is pure film mass inside or attached to the liver. Usually, it's a liver abscess. It's a common. Its cause is usually is abdominal infection. For example, it's appendicitis. It's a very common appendicitis or diverticulitis. It's a very common. Usually, appendicitis or diverticulitis is bacterial from its pathway into the liver. It's a form, it's an abscess. Yeah. So, if a liver abscess usually dilate about 10 to 30%, is high. It's before. But I recently, I think we gave a strong antibiotic. So I think it's mortality is lay look at. Yeah. So different country, different hospital, I think is mortality rate is different.
Excuse me, Professor. This appendicitis and diverticulitis, both of them are usually cause of acute abdomen, which are acute, right? And this liver abscess is usually chronic. It's not acute. So how can that lead to that if we do not treat these conditions initially? A patient can be in dire straits, right? So we have to treat it initially.
Yeah.
How can that lead to that? Because we have already treated the problem, right? So how can that lead to liver abscess?
Usually, if acute appendicitis is sometimes very severe, with severe infection, we first is give antibiotic treatment. If we cannot control, we usually maybe operation is a drainage, is a passive drainage outside. So during treatment we gave ultrasonography, understand the liver any is lesion, is infection lesion. Yeah. So I think no very easy diagnosis is a treatment. But it's diverticulitis. Sometimes diagnosis difficult. Do you know some person not as symptom? We understand is so we must do endoscopy is find is diverticulitis. So we then ultrasound find liver abscess, then find diverticulitis. So we diagnose maybe bacteria from here into the liver. So here differential diagnosis depend history of patient. So I think it's a surgeon, his experience very important. Yeah. So we liver abscess usually is a common form is liver abscess. Here show us pyogenic liver abscess and amoeba liver abscess. To have them all characteristics and etiology, cause and clinical manifestation and treatment. So different. Usually pyogenic abscess may be caused by the infection due to the illness or trauma. So different. So pyogenic abscess, different amoeba abscess, different. And that's a fungal abscess. Now that's the focal is pyogenic liver abscess. Is here shows is very common usually this abscess usually is a very common pathway. Just as I say, is abdomen infection such as appendicitis. As a biliary tract is abscess usually stone. It's cholecystitis and biliary traction or stone is obstruction. It's very common. It's biliary is a liver abscess. Another is hepatic artery for regional is infection, for example, sepsis, and subacute bacterial endocarditis is parietal tract infection and all. Is so pathway, biliary tract, and hepatic artery is a very common is a liver abscess. The liver abscess another is cause including the subphletic infection. For example, the open liver injury and congenital hepatic is a cystic second infection and qualitative genetic liver abscess. So this is liver abscess usually through the past culture we can identify is a bacteria. So liver abscess usually is multiple local is more than single is a lesion. So right liver is abscess can be more than easy infection is left liver. So usually it's right liver abscess more than left. The multiple lesion more than single lesion. This is liver abscess is very common. So if a liver abscess is a clinical manifestation, usually including is a chill fever. Another is a dual pain or tenderness is a liver lesion. Is very common. Do we know? Usually liver abscess is larger more and more. So patient expansion of liver capsule. So is a patient feel is a dull pain. Then we tenderness liver is region is enlarged. Is very common. But it's a symptom. It's a symptom usually is expect as a chill and fever. Another is a patient feel the nausea, vomiting, and loss appetite or fatigue. Yeah, this is clinical manifestation, including here. Liver abscess is a physical examination. We find is liver tenderness here, liver tenderness and hepatomegaly is very common. Is another way laboratory finding is WBC neutrophil is increased. Ultrasonography we find is liquid dark area is liver here. This we found is abscess is a wall. The wall is means strong echoes here, very large. This is a CT scan. Here is liver. Is abscess here. Here shows us is a larger abscess. Here is a wall of abscess. This is ultrasonography. This I think is diagnosis is very easy. If a patient suffering is liver abscess, we how to diagnosis. So So I think it's for surgeon, I first understand is the history of the patient. Particularly recently, patient any abdominal pain for acute appendicitis or any infection abdomen is a pain. It's very important. Another we understand the patient is chill, fever, the liver do pain, and particularly the hepatic memory is a WBC is increased. Then bacterially. So is we do ultrasound guide, we do temperature, take away any parts for culture. The understand is bacterial infection. So total together, I think this is liver abscess diagnosis, no problem. It's easy. If liver abscess, we the first we understand is abscess larger or smaller. So I think the first choice is primary disease treatment is very important. If a patient is appendicitis, is cause abscess, first I think appendectomy or give a antibiotic treatment is the first choice. It's very important. Then we ultrasound guide temperature and genital is very important. It's like this is we ultrasound guide is temperature is a lot of parts. It's genital. If like this treatment, the patient the continual high fever, sometimes we need to do a surgical operation. It's open, it's a drainage abscess. So like this, we open. If for long time, some patient is we do picture